Medicare webinar where our very known person will be talking about Medicare. He will help you wade through the intricacies of Medicare and help you clarify your doubts. Before I introduce our speaker to you, I would like to update you on current India House program and services. Just give me a second and we'll be there. So India House is a collective dream of around 140,000 Indo-American living in Greater Houston area. It started its operation in 2008, and since then we have been able to reach about 10,000 diverse community members each year, and assist some of our most vulnerable demographic, including at-risk children, the ill, and the elderly. The motto of India House was conceived as your house, my house, our house. And we still follow that creed today. We strive to help all those in need. Several community service programs got started at India House. These are the program listed like food distribution, Tai Chi classes, yoga classes, as you could see on the slide. These are offered at the free of charge, and some of these at a very discounted price. Due to COVID-19, we had to make changes and move most of our program from in-person to online since March of last year. However, by doing so, we were able to add some additional classes like BolyX classes, art classes, soccer classes, and the relationship coaching for needy people. India House started food distribution program in collaboration with Houston Food Bank since September 2018, which has become now a very successful endeavor. Every month we distribute food to around 400 families. Due to COVID, we had to put a hold on it in March last year, but we resumed it in July. And since that, with immense satisfaction and pride, I can state that we have been able to feed more than 24,000 people by now. We run a charity clinic. It's online now, teleconsultation from 9 a.m. to 12:30 p.m. every Saturday. Our yoga classes are held thrice a week on Tuesdays and Thursdays from 11 a.m. to 12 p.m. and every Saturday from 9:30 to 10:30 p.m. a.m. Sorry. Free line dance PolyX classes are held twice a week on Mondays and Thursdays. Line dance classes are held every Friday 11 to 12. Hindi classes are technology classes for seniors are now being conducted online by our young volunteers Mania, Manav and Mansi Rungta every Saturday from 12 to 1 p.m. Hindi classes are held every Sunday from 10:30 to 11:30 a.m. We introduce art classes for kids, which are held every Tuesday from 6 to 7 p.m. Recently introduced soccer coaching for the kids, which are held every Tuesday and Friday from 3:30 to 5:30 p.m. We are going to change it to 4 p.m. because we got a feedback. We give free family law consultation every Tuesday, 6 to 7 p.m. and also free immigration law consultation every first and third Wednesday by Attorney George Willey. 45 minutes complimentary session on relationship coaching every Tuesday from 5 p.m. by appointment. Well, you know, cricket is like a second religion to we Indians and also South Asian countries. So it's played every Saturday at India House. It's a taped ball cricket. Serene Harris Health Medical Clinic, which is housed in India House, is presently closed due to COVID. But however, the orthopedic lab is open for appointees. We do have a banquet hall where we host events, and we are now offering social distance seating following CDC guidelines. Anyone can book these halls. We have also started outdoors seating, and we have been booking halls outdoor if somebody is interested in hosting a party. These are our illustrious trustees who are the backbone and the strong pillars of India House. India House would not have been where it is today without their help, guidance, and support. This is the executive committee runs the operation of India House on day-to-day basis. Uh, we are saddened, last very recently we lost one of our executive committee member, Mr. Rajendra Soni. Uh, so India House is the result of effort, time, and commitment and money spent by hundreds of supporters and is deeply indebted to them all, our trustees, board of directors member, council member, general member, volunteers, partnering organization, and of course, India House staff. India House is your house, my house, our house. This was a little about India House. Now, before I introduce my guest speaker, I would like to go over a few housekeeping notes. Since it is a non-interactive session, the attendees will not be able to start their video, please. After the presentation, we will have question and answer session. Kindly post your questions in the Q&A tab, which you can all see, and we'll try to answer as many questions as possible. And now, our today's speaker is Mr. Anwar. He's fondly known as Kanwar Naresh Singh. He came to USA Houston in 1981. In between, moved to Florida. In 1999, he sold his business in Florida and moved back to Houston. He has been actively serving the community ever since. He has very keen interest in spiritual learning and meditation. After retiring from AIG, he joined hands with MetLife as financial sales rep and currently represents top careers. Well, as a subscriber to Medicare himself, he is fully aware how complicated Medicare plans can be. All Medicare Advantage or supplement plans are unique and may not be suitable for everyone. His job is to take the confusion out of your mind and help you take full advantage of all the benefits you are entitled to. Now, without much ado, I now present to you Mr. Anwar Raja.
Good afternoon, namaste, adab, sat sri akal, and welcome to our free educational seminar on Medicare. Swagat hai aapka. You got questions, we got answers. So folks, I welcome you, whoever is joining on Zoom, Facebook, Namaste Radio, or through Eventbrite. It is a pleasure to be here. And first of all, I want to thank Mr. Vipin Kumar, India House, and the staff for making it happen for us. And without their support, this was not possible. And as you saw during the introduction, they have been doing a lot of good work, and we need to participate, sponsor, or volunteer. Having said that, a little bit about myself. He did introduce me, and thanks for that introduction. I'm just a server, like many others. We all come here to serve. So in this capacity, I've been doing this, helping seniors since 2007. And now I'm concentrated on Medicare only. And a little bit about this seminar or webinar. This is strictly educational. There is, we will be talking in general terms only. There are certain rules which apply to us, and we are prohibited to talk the specifics of the Medicare plans. So, but general information is there. So folks, as you may be aware, Medicare is a very tough subject. There are 10,000 people retiring every day, and many of them in our community. And it is overwhelming to receive all those emails, letters, what we receive every time we open the mailbox, there it is. So it is hard to go through this and decide what to do, where to go, who to talk to, what is better for me. All those questions come up. So I'm here to help you understand those and go and make a good decision based on the facts only. So let's begin. But before I start, I uh, I will I will throw out some of the fun facts about Medicare. You know, everybody knows something about Medicare, but is it the right information? So, how many of you know that Medicare has more than one name? Have you heard about Medicare A and B, or Medicare Supplement Plan, or Medicare Advantage Plan? So it gets confusing. What is the real one? What is the original, or what is A and B? And what is this Advantage thing? So sit tight. I will be able to, and hopefully you will take something home out of that. I'll be able to explain that to you in simple terms. My job is to get the confusion out, as Colonel Kumar said. Now, do you know that Medicare does not cover 100% of your bills? And to emphasize that, I can use an example. Suppose someone has a severe illness or heart attack, and the cost of the treatment is $100,000. And does Medicare pay all of that? Not really. It is, they may pay 80%. I'm just talking in general terms. And you will be subject to that $20,000 payment from your pocket. Now, this is just one example. How about sometime the hospital cost can reach up to $750,000? Will you pay $150,000 out of your pocket? Are you ready for that? I have met people who were well off, but they ended up filing bankruptcies, and because of the higher cost. Also, there is a misconception that Medicare will cover long-term, you're getting old and you get some help. Medicare does not cover long-term care. The initial coverage is only for 20 days, and then it covers partially. And then the next important thing is that Medicare does not cover vision, dental, or hearing. So there is a lot left out. So this is the fact. First of all, the Medicare is not free. Number two, Medicare does not cover everything. So what we do, I'm not here to scare you or, but I'm here to give you some facts. There are some solutions, and we're going to talk about that. So let's begin with just the definition. What is Medicare? Medicare is a federal program which provides health insurance to the residents in America who fall in one of these three categories. So it is a health insurance federal program, and it provides insurance to one of these three categories. And what are they? You can see on your screen, it is listed. Either you are 65 years of age, you will be covered, or you are under 65 and you have some kind of disability. And third category is that you may be of any age, but you have that ESRD disease or a kidney failure disease where you need dialysis or kidney replacement. you will be covered. I think Lou Gehrig disease also included. So Medicare covers all of that. And so we're going to talk about Medicare in general terms. This is the definition of Medicare. And next, what we want to know is how to sign up for Medicare. It's kind of confusing. Do we call Social Security or what do we do? Well, there are, and I list here on the slide, you can see, there are 4 ways to sign up for Medicare. You can call that number on the screen and contact Social Security. There will be, these days, there is a long wait. You have to wait a long time to answer, but they will answer the phone and they will get your information. You may have to call again to get more information. Before you call, please make sure that you have your address, your driver license number, your social security card available to you, because they're going to ask all these questions. That is one thing you can do. And one option before COVID-19 was going to the Social Security office, and within minutes you could sign up. Literally, the wait time was more than the actual time you will spend with the officer over there. It was the easy part. It's not happening. Nobody's in the office, and I think they are working on appointments. And that leaves us with the third option, that is Medicare.gov. You can go over there, and there's an electronic application in Medicare.gov, and it connects to Social Security, and that's how you can fill out the application. And I highly recommend to take this option, but make sure that before we apply, that you have opened up an account on Social Security. On my Social Security, if you open up an account, it doesn't cost anything. They will get the basic information. And that way it will be easier to apply for Medicare if you already have opened up a Social Security account. So these are the few ways, we can, we can apply for Medicare. Now, the next slide, that will show the picture of the Medicare cards. The large picture with the John L. Smith, that is the newest card. Underneath it, there's an older picture or picture of an older card. That older card has been discontinued and it's no longer valid because it had Social Security number on it. So there were issues with the identity. So that has been discontinued. If you still have that card, please call Social Security office and apply for a new one. It will come in a couple of weeks, and that will be the valid card for you. Next slide, please. Okay, and now we're gonna move on to the interesting part. As in the beginning, I said that there are, it is confusing that there are the different parts of Medicare have ladder assigned to them. There is A, there is B, there is C, there is D. So what I'm getting into. So all these different parts of Medicare, they pertains to certain services. So we got to make a big difference in between these 4 different parts. And once you have knowledge of these, it is easy to understand and move along the rules. So I try to simplify for you. Out of those 4, Medicare Part A. What is Medicare Part A? Medicare Part A could be defined as a hospital insurance, and it is inpatient hospital insurance. Inpatient simply means the walls. You are in a hospital and you are covered because you are inpatient. You are being treated there. You are staying there overnight and you're being treated. So that is inpatient care in a hospital. Then secondly, you will be covered if you are in a skilled nursing facility and you are being treated, you will be covered there. And then there is another time you will be covered, that is hospice care. What is hospice care? If I like to define that because some people may not know. Hospice care is a specialized care which focuses on quality of life. And people who are suffering from diseases which can terminate their life is a life-ending situation. So they are treated with care, compassion, so they can enjoy whatever the stage they have. Uh, the efforts are made to let them have a full life up to their own limit. So that is hospice care, compassion and care hospice. Then the some home health care is provided under Medicare Part A, but that has to be some rehabilitative services. It is not home health, it's not long-term care. And so these are the simple qualifications to be on Medicare. Now, how do you qualify for Medicare? Well, if you have been working in United States and you have paid into Medicare for 10 years or 40 quarters, you will qualify to be enrolled into Medicare Part A. Now, people who are already taking Social Security before the age of 65, they are automatically enrolled at the age of 65. But if you are not taking Social Security and you are working, then it is a different story. But basically, you just have to be contributing 10 years or 40 quarters into Medicare, and you will qualify for Medicare Part A. Anybody has questions on that? No? Should we continue? Okay. So Medicare Part B, that is the second part of Medicare. Medicare Part B is known as medical insurance, and this is outpatients. Outpatient means that you are covered if the service by the providers who are giving you some service, some doctors or any other providers who helps you recover from your disease. They are covered under this Part B. It is an outpatient care. You go to a doctor's office and you get treated. That is outpatient care. You stay there a few hours. You are not there for whole night or 24 hours. That is outpatient care. Same way, some parts of the Medicare is covered under home health care. Somebody comes over, takes care of you. It will be covered under Part B. Then Part B is used to provide you with the equipment, Medicare durable equipment that may include a wheelchair, a walking can, or anything which helps you, and that is considered equipment, or it could include diabetic supplies. You need some syringes, that will come under this, durable medical equipment. And then the last part, that is preventative services. That is the best part of Part B. There is a list of services and they are available on Medicare.gov, or you can call Medicare, they will send you a book. And I was looking at that book the other day. It has about 10 pages of services, so long, like cardiovascular screening, diabetic screening, and flu shots, vaccines, all of them are covered. So nothing else, if you are a healthy person and you don't get sick, still Medicare Part B will help you to go through this, and it can help you stay healthy. And when you join Medicare, they have an annual wellness checkup. That is a great thing to do for a healthy person, to join Medicare and get yourself checked. And most of these services have very little co-payments or none at all. It depends on what kind of service you are getting. So that was Part B. Now, there is another service. Another component is Part C. And as you know, a lot of time it is a confusion. Oh, first of all, do you have any questions about Part B? Anybody? Everybody clear on Part B?
So Raja will take the question and answer later on.
Okay. All right, I continue. I just don't want to get anybody bored. Okay, Medicare Part C. All right, that is my favorite. Also known as Advantage plans, and the simple definition for Medicare Part C or Advantage plan. Let's say we just use the Advantage plan. Advantage plan, they are bundled up plans which are offered by private companies who are monitored and authorized by Medicare itself. And they are legally required to provide all those services which are under Part A and B, which we just discussed. They are required to provide all these services. And they can offer some more on their own, some perks, and they can add additional benefits to you. So these plans may provide you vision, dental, or hearing. Some plans are now providing transportation, and they compete with each other. Another thing is, since it is a private sector, so they have the ability to make their own rules. They will determine what could be deductible and what will be the co-payment. It depends on each and every plan. Every plan is different. It's no one size fits all here. That's why it is important to talk to a professional when you are dealing with plans. As I said, we are not allowed to talk about specific plans, so I just leave it there. They have their set rules and they have additional services. And there is one more thing which stands out that is unique to these plans. That is out-of-pocket expenses. Remember that example I used, that you have a heart attack and you pay so much out of your pocket, but apply that here. In Advantage plan, if you have an Advantage plan, there is a cap on it. So a plan will tell you before you join that there is a maximum out-of-pocket expenses in a given year. So in a bad year, maybe you use your co-payments, you go to doctors and you have to pay something. You go to a specialist, you have to pay something. All of that add up. But once that maximum out-of-pocket expense is met, then there are no co-payments. And that is the beauty of this Medicare Advantage plans. So, and they are very reasonable. You know, uh, some plans only 2,500, some more than that, but very, very reasonable. Under I think it is under $10,000. Anyway, so that is Part C. And now I also need to mention here that what Part C does, it includes, since it is a bundle up plan, it is one plan for everything. You will have hospital insurance, you will have doctor's coverage, you will have all the additional benefits, and they may include your prescription drugs too. And they are included in most of the time in Part D. And so that is the benefit of having this plan. Okay, let's go to the next one. Now, this is the Part D plan. Part D is also actually, I think I can say that it is an Advantage plan, but it is a standalone. You can buy it is optional. And the reason you will buy a prescription drug plan because it can reduce your drug cost. As a professional, I have seen people, complaining about high cost of drugs. Even after using the RX card or signing up a plan, they still complain about the cost of drugs. Insulin is so expensive. There are some drugs which are very expensive. So if you happen to be taking quite a few medications, this makes sense. So it can be bought standalone, or it could be part of Medicare Advantage plan. So that is Part D. Next slide, please. Okay, so having all these options available to you, how to decide what is best for me? As I said, there is not a single plan, but if you are turning 65 in a few months, basically you have only two options. And those are either you stay on original Medicare, you are about to turn 65, you have 7 months window, you can join Medicare, you have your doctor's coverage and your hospital coverage, And with the understanding that this is a little expensive, but hey, I make enough money, I can pay deductibles, I can pay um, co-payments, I'm good. And you can have Medicare, original Medicare, and that is well and good. However, if you feel that maybe in future, today you are healthy, but tomorrow, maybe a few months from now on, you may have to see a doctor, or may we are baby boomers. I'm not talking about my age people. We are here for a long time. We may be healthy today, but think about that. Will we be healthy 20 years from now? So it does make sense to get some additional coverage, because if Medicare does not cover everything, there are some supplement plans you can take, you can have, which will cover you for those gaps, and they will provide you hospital coverage, and that 20% will be covered. They are called supplement plan. Okay, so that is one option, and you can have some drug coverage. Now, in these plans, just keep in mind, it, though you have Medicare, but for these policies, this is additional. You will be paying for your supplement plan, and if you added a drug plan to it, you will be paying for that. Other option is, and that is an easy option. There's no comparison. They are both different animals. I must say that, because a lot of times there's a confusion. Medicare Advantage is not a supplement plan. Supplement plan is also known as GAP. I hope it is understood that these are not two same, these are separate plans. They are not same. So you can get Medicare Advantage plan or supplement plan along with original Medicare. And any questions we have to cover next then. So you can have Medicare Advantage plan, a comprehensive plan, which will give you all those coverage under one card. And if that plan is accepted by your doctors and by your hospital, you are good to go. And by the way, these plans, Advantage plans, you have the ability to change every year. There are certain periods when you can change those, you can make a change. If this plan does not work, you can change those plans. And but let me talk about Medicare Part B. Just go back to the slide in Part B. Part B, this is an old slide for 2020. So don't worry about the numbers. The Medicare Part B premium changes every year. And this year it happens to be $148.50, $148.50. That is the plan monthly premium on that. Why I want to talk about Part B premium, because I have noticed that in our community, there is a tendency to not to worry about Part B because you are healthy or you have some kind of insurance. But you have to be very careful. Medicare will allow you not to sign up for Part B. It is an option. It is not mandatory. If you have a creditable coverage from your employer, and that is as good as Medicare, just emphasize on this. If the Medicare coverage from your employer is as good as Medicare itself, you're allowed to keep that. But remember, the employers who have less than 20 employees may not qualify for that. And because they may not qualify to become secondary insurance because they are not as good. And you may have some plan from some company, Blue Cross, Blue Shield, Aetna, or whatever. All those plans may not be, qualifying for Medicare to become Medicare secondary payment. Number one. Number two, if you were eligible for Medicare Part B and you did not have Medicare coverage from the employer, basically you were without coverage for a few months or a month or 2 months or whatever, and you were given the chance through a special enrollment period, and Medicare does that. Every year you have some period where you can join Medicare, and once that is over, then a penalty will kick in, which is 10%. If you did not sign up for Medicare Part B because you felt you don't need to, and you will be subject to 10% penalty whenever you are ready to join again. And it becomes very, very expensive. For example, if you did not join 1 year and lost all those chances, 10% of $148.50 is $14.80. Add that to your monthly payment of $148, it's going to be $163.30. And I have met people, real life people, who will be paying this every month, $163.30, either taken out from the Social Security check, or you'll be paying directly to Medicare or the plan you have, $163.30, because you ignored the chance to sign up for Medicare Part B when you were needed to. That is one thing you have to consider. Another point is that Medicare Part B premium is based on your income. So just use this as 2020 slide. You can see if it was year 2020 and your average income was $87,000, and if you are filing jointly and your income was $174,000, and a lot of people, fortunately in our community, do fall in those categories. There is a adjustment, so $57 means that if you make good money, your Part B premium is more than $148.50. And regardless, you have additional coverage as a supplement plan or advantage plan, that Part B premium has to be paid. And so be careful when, we have to be very careful and talk to a professional whenever there is a need. And that's why we are here. So on next slide, again, repeat, where to get help. And there are professionals who can help you. You can trust somebody who can walk you through from sign on to talking about your plans and guide you through. And also people who are seasoned. I know in our community, there are people who have been on Medicare for years. Why? They need some help. You could be a good doctor, engineer, or any professional, but when it comes to Medicare, it is not uh, clear to all of those professionals who are good in their professions, but they may not know about Medicare. So you have to go through and people who specialize in this. And we can walk you through, we can help you in the difficult situations. There are incidents where you have a question, should I call my company or my plan because I want a second opinion? Now, this is the technical question. You went to a doctor, you don't like the answer, you want to go to another specialist. So that's where we come in and help you by clarifying those, talking to the plans, talking to the people who are involved, and clarifying for you. Because if you got the second opinion or something to that effect, and it was not paid, you will be paying out of your pocket. Okay. Now, something but it's not on these slides, that is, people ask me all the time, what is the difference in between HMO or PPO? I just want to clarify that. PPO is a preferred network. HMO is a health maintenance organization, and they relate to Advantage plans. Advantage plans are based on group of people who enroll in that group in certain areas, and that's how the costs are determined. And you have to have a referral to go to see other specialists. But in PPO plan, they are a little bit different. You can see other specialists with the additional payment they will allow you. So these are basically organizations who get together, they sign a bunch of doctors, service providers, hospital, all kinds of specialists, and they group together all of them. The famous rule of insurance, law of large numbers apply here. The larger a HMO is, the lower their cost is. So that's what the Advantage plans do. Okay. Well, that's my presentation. Thanks for listening to me. And if there are any questions, we will address. I have Kevin Tran here helping me on the computer. And also I have uh, a very senior professional with me from our team. Cindy is here. She's a veteran in Medicare, so she'll be helping us too if there is something I could not answer. We are all students, no matter. Medicare is such a field that even if you are here for years dealing in Medicare, you still have some answers, um, still have some questions to answer. So
So, Mr. Raja, thank you so much. I will take some questions now. One of the question is, who are the best people? And for all the attendees, you can please type your question in the Q&A tab, and we'll try to answer as many questions. So there's a question, who are best people to contact for guidance on selecting best supplemental or advantage plan?
very good question. Best is the person who you can trust. That is the main thing. Uh, the professionals have to qualify, they have to be licensed and certified by carriers, and they go through continuous education. And I will say the people, anybody who has right credentials, is experienced, well known, and you can trust, and the person who has the best interest of you in mind, that is the person to go to. You know, it is not overnight money making scheme for us. And I will be very, very clear to you how these people or people who are professionals, they make money. So you have to know how this happens. When somebody signs up for a plan, a company pays them a set amount of money. And then there are people who are independent agents who are signed up with more companies. They are not working for one company, they are working for more than one company. And they have the ability to sort out the best plan for you based on the circumstances. There is not any bad or good plan. Every plan is different. You may not need a dental coverage. You may not need hearing, and you may not need, some other uh, benefits, or you may need transportation. I have been constantly asked to find plans which will give money back. There are some plans these days because these plans get a lot of money, I don't know how many hundreds of dollars from Medicare. So companies receive these payments from the Medicare. And based on the number of people who are signed up for a plan, they share their profits with the people. And so nowadays, some companies are even reimbursing them back. That $148.50, some of that money is being sent back to the participant in certain plans. And I will need, I can't name them because Medicare does not allow us, but it based, it based on your need. A person who will sit down with you, who will listen to you and analyze your situation. Every situation is different. Everybody's needs are different. So that is the person to go to. Trust is the main thing. If you can't trust a person, if that person is only there to write a policy for you and will disappear after doing this, has not rooted in community and in grounds, you may want to avoid a person like that.
Okay, how do you decide between a Medicare supplement plan and an advantage plan?
Very good question. And I will, just to change the tone, I'll ask Cindy to just jump over and say a few things about supplement plan. She's a specialist. You can see her, but she will be talking. Cindy, is your name on the computer? Can you unmute Cindy, please?
1 second. Is she here?
Yeah, she's here. She's in the office. She will be online.
No, unmute means she's as one of the attendees.
Yes. No,
Okay.
she's not. She's with me. I mean, I can answer those. Let me start it, and she can pick up. So supplement plans and advantage plans, they are two different kind of plans. Supplement plans, they are uh, they are also they're known as gap plans. Means they only provide you with they fill the gaps left by Medicare. Medicare does not cover everything. They do not cover that 20%. So these supplement plans, they pick up that, and good thing about supplement plans is if you buy a supplement plan, you'll be paying additional premium beside the Part B premium, which you already pay $148.50. You'll be paying additional premium for those supplement plan, and they are standardized. They are standard plan, and every company charges differently, but they have the same kind of benefits in every plan. And if you happen to be traveling outside, and some our community members constantly go outside the country, these plans, like one plan G, covers 80% of your travel when you are outside the country. So these are the kind of benefits they have, but they are limited. They will not provide you additional services. They are only there to help you pay your Medicare costs, which are not covered by Medicare. They are good plans. On
So
the
why
other,
should one buy a supplement policy instead of advantage plan? This is another related question.
yes, yeah. The question is because Advantage plans, as I said, they are considered HMO, PPO plan. They have organizations, and sometimes people do not like to change their doctors. They have the ability to pay for these plans. They can get these plans. It is just a choice. It's not for any preference or one or the other. It is what is good for you. And okay, so you can choose Advantage plan if you uh, if you want one plan to take care of you. Everything in one plan is easy of use, but you have to be within the organization, an HMO or PPO, and that is the biggest difference. And they have more coverage. And some Advantage plans do cover you when you move out of one state to the other and you're traveling. And but the supplement plan, there's no restriction like that. You can have supplement plan here, and you could be in Atlanta, Georgia, and see a doctor there who takes that plan.
No.
So it is a preference. We need to evaluate each person's needs, what they are looking for.
Okay. What are the penalties if you don't join Medicare?
Good question. I addressed that earlier, but I'll repeat. There are two penalties, but I will mention one. The penalty for not joining Medicare is when you need it is 10% of the monthly premium you pay on Part B, and it could be hefty, and you could be paying all your life. As if the premium is $148.50, and 10% of that in a month, if you don't join, that will become $14.80 together, $163.30. So that is lifelong. And then there is another kind of penalty, which is kind of complicated. I hope I don't confuse anybody. It is for those people who did not have creditable prescription drug coverage. If you don't have a prescription drug coverage under Medicare or any other coverage, you may be subject to penalty, and that is 1% of national basis beneficiary premiums. And this year, that is $33.06. That is the premium they determine a, a drug prescription plan will have. 1% of that, will be charged, and so that could be about $10.25. So both kind of penalties can apply. So again, please talk to the professionals who know these things, and there are limits to that. If you are out of coverage for 63 days, that penalty for not having prescription drug coverage will apply.
Okay, another question. If I need to spend time in two different states, is a supplement plan better?
Okay. Good question, Dr. Kumar. And so, yeah, I mean, supplement plan is not based on because you just travel. That is one of the advantage you have, one of the facility you have. Yes, it will be better because you are moving from one place to the other. And advantage plan actually uh, need to be changed even within one city. You are moving from one zip code to the other. You will need to change the advantage plan, and because your doctors may not take it, and your hospital which you used to go may no longer will be covered, so there is more there. And supplement plans, if you like, people keep them for years, and as long as you agree to pay for that, I cannot, as a planner representing both plans, it's not my job to decide. You have to have the ability to understand what is good for me. I can only help you, I can only make suggestions, but decision will be yours.
The next question reminds me when I was not growing beard. I was a child, and I used to look at my brother who used to shave, and I used to fancy, and I say, "Oh my God, when will I have beard and start shaving?" And
Yeah.
now, now I say, "Oh my God, if the days were back." So on the similar line, somebody has asked this question: isn't Medicare free? I wanted to get 65.
Oh, yes.
Medicare was free.
Yeah, I get that all the time. Well, the answer could be yes and no. If you're talking about free Medicare, see, Part A of Medicare, you have paid into that, and your employer has contributed to that plan. And at the age of 65, you joined Medicare, and now only Part A, you don't have to contribute again. You qualify. You paid into for 10 years. You have done 40 quarters, so you are fully covered. So you are not paying anything for having Part A. But on Part B, you are paying a premium, and then you have deductibles and co-payments. Unfortunately, this is where not us, but the politicians have to do something. Where we could get better arrangements on Medicare, but we are stuck with it. This is what this is, and there is nothing I can change. On Part, uh, I'll use an example. Suppose you have Medicare, and you all of a sudden you go to hospital and you have original Medicare only. There are some deductibles involved. That is $1,484. I didn't want to go there with the numbers to make it simple, but you have only original Medicare A and B, nothing else, no supplement plan, no advantage plan. You go to the hospital, and that will apply to you $1,484 each time or each benefit period until you meet 60 days. After that, $371 per day from 61 to 90 days. And then there are some lifetime days, and you still pay for that. So it becomes very, very expensive. I will say that original Medicare is good as long as you are able to afford it. But everybody else got to have something different, either a supplement plan or advantage plan. But there is nothing which is free. I'm sorry.
Next question is, we have Medicare plan A, B, and D. We also have supplemental plan Blue Cross Blue Shield.
Okay.
Premium are very high now. Can we switch to Medicare Advantage plan now? Is it a good idea to change?
Well, every year, general election period, it depends on, what do you like again. Uh, I cannot favor advantage plan and supplement plan. If you feel that it is very expensive and you want to reduce your cost, yes, of course, you can change. But there is a period involved. And that period was uh, general election period. You can drop it and go back to original Medicare. Once you are on original Medicare, then you can join Advantage plan. But yes, you can do that. Medicare will allow you to drop the supplement plan and move to, but the thing is that people have to be very, very careful not to drop their policies because they may not be able to, suppose they don't like Advantage plan and they want to go back to supplement plan again. Now there will be medical underwriting involved, so you have to be very, very careful. That's why very first decision when you are turning 65 is very, very important. Get on the plan which works for you. And yes, you can do that.
Okay, we have 4 more minutes left, but we'll take few more questions. Uh, is there a supplement plan where you pay a high premium, but then pay nothing for doctor's visit or hospital costs?
That's what supplement plan is. There was one plan, Plan F, which has been discontinued for people who are turning 65 now. But if you were already qualified 10 years ago, you started with Medicare, you still can get that plan. It's Plan F, which pays for your deductible, which pays for your premiums. It covers everything. It even covers you when you're out of the country. It is a supplement plan. Now, for the new people, there are some other plans like a Plan G, which is, in most cases, I don't like to compare plans while we are doing the webinar. I hope people will call us, make an appointment, and we can sit down and compare apples to apples, oranges to oranges that way. Yes, but we can reduce the cost by comparing some different plans. These plans are standardized. The services are similar, but the cost could be different from one plan to the other. And that's where we come. We have access to, actually, you can go to medicare.gov and you can see those listings. But sometimes, they may not have updated listing. We have that. We directly connected with the companies and we can give you the cost, what is applicable right now. Yeah.
Okay. Can I change between the supplement plan and advantage plan in any year during the allowed time?
No, there are certain periods involved. They are not interchangeable. Like annual enrollment period, which starts in October 15 to December 7, that is enrollment period. At that time, you can do pretty much everything. But to disenroll from different plans, that is a different enrollment period. Yeah.
What if I choose a new doctor or a specialist and she does not accept the plan?
Well, I will, first thing I'll ask my doctor, if I'm the patient, I'll ask the doctor, what plan do you take? Once that is known, yeah, the plan could be changed during certain periods. You got to have a special enrollment period for make this kind of changes. And there are so many occasions, like special enrollment could be for that person who just moved from one zip code to the other, or or have been out of the country, or have been very sick. People who have diseases like heart disease, chronic disease, they may qualify for special enrollment period. They can change. Other than that, we'll have to follow certain periods when you can change from one plan to the other.
Mr. Anwar, I'll ask, I think this could be the last question, but looks like a very interesting question to me. Somebody has asked that you said your consultation is free.
Yeah.
How do you make money?
How do I make money? I don't. Just kidding. Well, the people like me, we like to do these educational seminars because this is how we give the education, and better educated people will come back to us and ask for more consultation, which is also free. We get paid by the carriers. Medicare does not pay us. We are not paid by Medicare directly. Medicare pays these carriers, and carriers pay us. So we get some benefits from these carriers each time when we enroll somebody in a plan. Now, the beauty of this is independent agencies, that we have the ability to choose whatever we want to, because the payments we get, they are pretty much same from every company. They are set amounts of money. I'm not better off by writing a plan for Aetna or Blue Cross Blue Shield or Co or Devoted. All is same to me, you know, because I'm independent. So I get treated differently. But
Okay.
somebody who's dedicated to one company is a different story.
Thank you, Mr. Anwar. Thank you so much, Mr. Should I call you Anwar or should I call you Kamar
Kanwar
Naresh?
Singh, Kanwar Naresh Singh is my favorite.
Thank you so much for this wonderful, wonderful talk. I think it's very enlightening, and there are questions and questions coming, and I think it'll take. We'll organize another webinar for that. But
Yeah,
thank you so much for this wonderful session and your all your input and your sharing your knowledge and giving us time. Thank you. And
thank
I
you. And
must
again,
thank all the participants, all the attendees for doing attending this webinar, and I hope it's been of some use to everyone. Please feel
hopefully,
free to contact Mr. Anwar, and if you haven't caught his number or email, please email me, and I'm immediately going to forward it to him. With this, I will close this session. Once again, thank you, Mr. Thank you, Kamar Saab, Kamar Naresh Singh ji, and thank you, everyone. And thank you, my
appreciate it. Uh-huh.
staff, for this wonderful presentation.
Bye
Thank
bye.
you, and have
Namaste.
a nice day. Bye bye.